Welcome back. So we are now learning more about Ontario's vaccine rollout. Residents 80 and above bracing to roll up their sleeves about this next phase of COVID-19 vaccinations. But how will this phase 2 help when it comes to our battle against the virus? For more, I'm joined by the president of the Ontario Medical Association, Dr. Samantha Hill, joining once again here on Breakfast Television. Good morning to you, Dr. Hill.
Good morning to you.
A lot of criticism around this rollout that we are behind other provinces, especially with this online portal, which, does boggle my mind a little bit because it's not like we couldn't have seen this coming. But I digress. Let's talk a little bit about the rollout and from your perspective on what you see as some pros and cons here.
So I don't think it's fair to compare to other provinces. I know it's an easy thing to do, but the breadth of geography and demographics in Ontario is so different than any other province. It's actually one of the strengths of the rollout here is that we are using our strength of our local public health units. And so it's very different even from a local level. So from a provincial level, it's even more different. But that being said, you're right. There's lots of things that could have been done differently, and history will be the judge of that for sure. But it would be nice to be a little bit more on top of things when it comes to the communication of the plan.
Indeed, I know a lot of physicians were being contacted, family doctors, what's going on, what's going on? What kind of communication was there or wasn't there provided to physicians?
Right. So last weekend, family physicians were pretty busy, unfortunately and unnecessarily, telling their patients that they didn't know anything about the plan that had been voiced over the Friday afternoon media session. And it was really frustrating because we are here to help. We are here to use our experience. We are here to leverage our relationship with the patients in order to get those vaccines into arms and to make sure that the plans work once they get to the ground level, once they get to the point of actually being administered to patients. But we can't do that if we're continuously caught off guard by Friday 5 p.m. announcements that are made to the public before they're made to us.
Okay, so definitely communication needs to be clearer. You've been very clear and outspoken in the reopening of the province and what you hope can be done. When we're looking at the red zone, there is limited, let's say, dining in restaurants. And that's something that you say, do we need to have that happen? So here's a look at some of the map across the GTHA. In your opinion, did we reopen too soon? Should we be holding back in Toronto Peel longer? What would you like to see?
So I think we might have opened a little bit too soon, but we'll, again, history will be the judge of that. The idea was that as we reopened and sent everyone back to school, that was going to cause a little bit of an uptick in numbers, and we knew that. And the variants of concern are also going to cause an uptick in numbers because they're so much more contagious. And we were trying not to compound things by having both of those and the widespread reopening that we've seen. So we really did want to go slowly and gradually. We know that the variants will be the dominant strain by mid-March. And so to see what happened as each individual thing took effect, as opposed to compiling them. When we look at this region, we also recommended that the regions that are in the red zone continue to ban entirely indoor dining and other maskless activities. So nothing that would have you with a non-household member without a mask on. And there are other ways to support your local businesses, of course. And in regions that aren't in the red zone and regions where indoor dining is permitted, to make sure that only household members stay together. And the reason for that, of course, is simple. When you take off your mask, you're at increased risk of transmitting the virus. And so we're just trying to make sure that people continue to do the right thing as far as protecting each other. And that's hard to do when they get mixed messages.
We are learning a little bit more about some of the vaccines and some encouraging news with Johnson & Johnson, learning more about Pfizer and using Israel as an example, seeing a lot of their population vaccinated, which is great to see. Sad for us to see on this side of the world, but great to see that it is working. What is your take on the vaccines themselves and some of the encouraging news that we're seeing when it comes to data?
When it comes to the data, it's really exciting. We're seeing good information that the vaccine is not only effective against the original strain, but also against these variants of concern. We're seeing some pretty good evidence that even the first dose independently offers significantly more protection than we thought it would, which of course was breath of relief for many of us as we waited for second doses. And I know that that's even a sore point because so many people haven't even had their first dose. Mm-hmm. So the data is showing us good things. Of course, this is now a race. It's a race between the vaccines and the variants of concern and to see which ones get to the most vulnerable populations first.
Dr. Hill, I wish we had more time to chat with you, but appreciate, as always, your insight. Thank you so much.
Thank you. Stay safe.
You too. 6:23 is your time right now, and coming up next, we're looking at some new data suggesting that healthcare workers in one nation are hesitant to take the country's own homegrown vaccine. We're going to tell you where and why next.